Well, a wide range of issues to discuss on COVID-19 and, of course, the resurgent one, Omicron. Well, let's bring in our guest, Professor of Virology, Oyewale Tomori, and also in our offsite studio is Dr. Mukhthar Muhammed. He's the head of the Presidential Steering Committee. Thank you both, gentlemen, for joining us on Newsnight tonight. Let me start with you, Dr. Mukhthar. Because you are at the head of the Presidential Steering Committee. First off, Nigeria has enough vaccines to cover 70% of the population by the end of 2022. What are the strategies in practical terms that you're going to be deploying, or you're deploying already, to bring this about? And are you concerned that only 3% of Nigeria's population has been vaccinated so far? What are you doing about that?
We are seriously worried. We are seriously concerned about the hesitancy that we have seen. We are concerned that many people are not coming out. People who are eligible to take this vaccine are not out taking the vaccines as they're required to do. It is not that we did not project or did not predict that this is going to happen. However, the resistance is actually beyond maybe what actually we could have overcome. So in essence, what the government is doing is to try to enlighten the people, create more awareness, engage the communities, engage traditional rulers, engage traditional leaders, and also get people to take responsibility. Government alone cannot be able to deploy resources alone and then get people to get vaccinated. People have to understand the reason why they need to get vaccinated. If they don't understand, they are not going to be cooperative. So we are doing our best to try to engage all the critical stakeholders, particularly the non-conventional stakeholders, community gatekeepers, to make sure that people become aware and people will readily bring themselves to get vaccinated. Yes, we have commenced with vaccine mandate. This is only to make our working environment to be safer, and we hope and encourage other businesses, other business owners, other government agencies to also try to make their workplaces safer as well, so that people will now respond and get vaccinated.
Get back to you, Mukhthar. Now let's bring in the Professor of Virology, the person of Oyewale Tomori. Prof, let me ask that same question in a different way. So government is aiming to cover 70% of Nigerians by December 2022. Laudable, interesting. Why are we still at 3% vaccinated? Where do we lay the blame? The government, the people, or both?
Thank you very much. I think the most difficult issue in this is the fact that the people themselves don't believe that COVID is a major problem. That's number one. And I think the error came right from onset. You remember when COVID first came, and I keep saying that both in the West and here, we're all talking out of ignorance. None of us knew anything about COVID when it started. And so when somebody from Europe says, you're all going to die, 100 people on the road, so people were expecting that death is the solution, is the end of COVID. And then when they got here and found that they were not, when they got here and found that they were not dying of COVID, they thought, no, then it's not a problem. And therefore, now you're coming back and saying what you consider not a problem, and you say you're giving me a vaccine for it. Of course, they're not going to abide by that. So I think we made a little bit of error, that letting people know that death is not the only thing about COVID. People get infected, they get sick, you can recover. And from the studies that have been done, many people are infected in this country, although they are not dying. That's the first one. And I think also, if you're going to tell people to go out and get vaccinated, you should have the vaccine ready for them. We only got 10 million, I can't remember what the number. And if you go and look at the
32 million, as we hear.
80% of that was all donation. The government itself has not gone out. They tell us we're having 200 million coming in. They say in the pipeline. How long is the pipeline?
No, but they say they have ready for the 70% they want to achieve? They have enough vaccine now.
They said they'll have enough vaccine to vaccine 70% by 2022. Does not mean they have the vaccine now.
Our report actually told us that what they're saying is that they have enough.
I'm not too sure we have 200 million doses of vaccine in this country at this time.
Okay. All right. Well,
they use the word pipeline. And the pipeline can be as long as from here to 2022.
All right. We'll take a short break and return with more, gentlemen.
We're glad to have you back. You're still watching Newsnight here on Horizons. We still have with us the Professor of Virology, Professor Oyewale Tomori, and also the technical head of the Presidential Steering Committee on COVID-19, Dr. Mukhthar Muhammed. Both of them are in our studios. Let me get back to you, Prof. Both the federal government, through its Minister of Information, that's the federal government, through its Minister of Information, Lai Mohammed, says that the decision by the UK, to ban Nigerians is not driven by science, therefore should be rescinded. Even the High Commissioner is also towing the same line. What's your sense of the stance of the government and the High Commissioner to the UK?
I will stand by the statement made by Boss Mustafa. He says we will review and come to a decision, which is quite different from what the Minister of Information said. I think it is important to say that I was listening to the Minister of Information. Some of the things he said were not actually quite correct. And I think we need to correct that. Britain has already got 27 cases, according to them, of people coming out of Nigeria and testing positive in their country. The same argument that the minister is using, that even the 2 that got into the country were from South Africa. So really, the point is that they left your country and they got positive. And I get worried. How come 27 people in less than a week will be found positive there of people who supposedly left this country with, I hope, they couldn't have been positive because they won't let them travel. So are we not looking at that? Are we not examining that? How come 27 of those will be positive? And then all we're getting, and then these are people supposedly who had come out of the country with hopefully negative results. Those are the things we should be examining. And that puts a little bit of lack of trust in your system. And all those are the factors they must have put into it. We should be examining that and not just talking about people being whatever.
Okay, Dr. Mukhtar, what then is the Presidential Steering Committee doing to plug these loopholes that will lead to such embarrassment for Nigeria? And the UK Minister for Policing, Kate Malthouse, says the phrase travel apartheid was very unfortunate language, that the UK is only buying time in order to determine exactly how serious this new Omicron variant is. What is the Presidential Steering Committee doing to check this? And what actions will you be taking? Because Lai Mohammed said that the PTS Steering Committee, PTC, will respond appropriately very soon to the British decision.
So actually it is not something that is new. You recall that a few months ago, Nigeria placed restriction on some countries because of the high risk they imposed. And when we put those 4 countries under restriction, we were getting a lot of positive people who tested negative in the UK, but on arrival in Nigeria, they were testing positive. And there were a lot of them. We got them from many countries. But our decision at that time was to look beyond just the people that have been tested, but to look in totality the overall risk that those countries have posed to Nigeria, and also consider other items before we place restrictions. So what UK is observing now to say that people who tested negative in Nigeria are turning off positive, we have noticed that long ago, over 3 months ago, and the numbers are really not small numbers. In very large numbers, we had those things. What did we do? We did not go out to ban British citizens from coming into the country. What we did, we put additional level of restriction to ensure that when people arrive, they do their test on day 2 and they also do their test on day 7 and also monitor to find out whether they are doing the isolation or not. We also went through a similar kind of issue with United Arab Emirates. You recall that was what led to the so-called impasse at the ban of Emirates airline. Now they have realized the position that we had, and they have reconsidered and now therefore lifted the ban. Nigeria is the only country in the world that for outbound passengers, we certify the test. Apart from the passenger doing the test in a private laboratory, these tests are subjected to quality assurance by our own Nigeria Center for Disease Control. And any result you get for traveling out of Nigeria has the stamp of Nigeria Center for Disease Control. I'm not aware that any other country is doing that. Now, that is what we do in order to cross-check, to make sure that Nigeria is not importing is not exporting cases to other countries. And you also look at the current revision we had on our travel protocol. We now said that every passenger that is leaving the country must present a 48-hour PCR result, whether the destination country requires it or not, because we want to be sure that we are not exporting these cases to other countries. We also added to that condition also that people should have fully vaccinated or provide the 48-hour test. So there are measures that you can place other than banning flights. When you ban people, you ban citizens of the country, certainly there are other considerations, there are other motives other than just trying to prevent COVID from being exported into your country. So what is the PSU going to do? Certainly, we are going to meet, we are going to consider the situation, we are going to look at all sides, as we have done all the time. We have never taken any decision against any country based on sentiment or emotion. We look at the science, we look at the data, and then we meet out what resolutions that need to be meted out, to countries that pose risk to Nigeria.
Thank you so much, Mukhthar. Prof, that's exactly, let's be clear, the High Commissioner Ishola was quoting the UN SecGen when he talked about travel apartheid. They weren't particularly his own words. But the High Commissioner to the UK, Ishola, while speaking to the BBC, says that Nigeria has not taken such an action. Mukhthar was referring to it as UK, when in November about 60 plus travelers from the UK tested positive. So if Nigeria didn't do this, why should UK be treating Nigeria the way it is doing? That's the question that the High Commissioner is asking. I'm putting that to you, Prof.
Well, let me say one thing. There are regulations and there are regulations. Each country decides what is best for it. Each country has a right to determine whether it's 24 positive or 5 positive or 6 positive. So we shouldn't be comparing numbers. There are regulations which are put down by different countries. And the country said, if this number is positive from your country, and I think it's a matter of whether you trust your system or not. And so let's not compare numbers. And that's the point I'm trying to make. That we have a right to decide. We're okay with 60 and we didn't ban them. For them, 24 was too much and they banned the transport. So it's their right as a country. And the point I was also trying to make was the fact that we should speak with one voice in this country. I hear my friend Mukhthar talking about the fact that they are going to look into it and review. Minister of Information is already saying rescind it and change it. He's already taking a decision. When you don't speak with one voice, you create problems for yourself. And that's what is happening.
Let me take it back very quickly to Dr. Mukhthar. All right, so many fundamental issues. Locally manufactured vaccines. What is Nigeria doing in that regard? And how is Nigeria preparing for, future outbreaks? From all indication, the next outbreak could be deadlier than imagined.
So that is why we are taking these 2 days to have the National Summit on COVID-19 to review, our strengths, to look at our weaknesses, examine the challenges about our performance, and look for solutions and what we need to do forward. What is something that is bigger than just reviewing our performance is lifting our heads beyond, to look beyond the horizon and see what is the future framework that we need to build for a sustainable framework for the national biosecurity system. So really our attention now is centered around building safety and biosecurity for our country to protect Nigeria and Nigerians against any further threats, be it biological, chemical, radiological, or any or otherwise, so that Nigeria will have a sustainable system to build it. And we hope that we will have that recommendation at the end of the summit.
All right. Well, thank you, Dr. Mukhthar Muhammed, the technical head of the Presidential Steering Committee on COVID, and of course, the Professor of Virology, Professor Oyewale Tomori. Two gentlemen, thank you so much for your allowing us to pick your brain on the program Newsnight.